The role of acupuncture in addiction treatment, mechanisms, clinical evidence, and applications. Addiction is not merely a failure of willpower, it is a complex neurobiological condition that rewires the brain's reward system, altering dopamine pathways, stress responses, and emotional regulation. Conventional treatment approaches, such as medication assisted therapy and behavioral interventions, often struggle to fully address the deep rooted neurological imbalances that sustain cravings and withdrawal symptoms. However, modern research has revealed that acupuncture is far more than a passive relaxation technique. It actively modulates neurotransmitter systems, restores brain homeostasis, and influences addiction related neural circuits. Studies have shown that acupuncture can normalize dopamine fluctuations, enhance endogenous opioid activity, and regulate the GABAergic system, helping to suppress drug seeking behavior and reduce withdrawal distress. As we look at how acupuncture helps with addiction, we'll explore how it influences three important areas of the brain. First, it affects the brain's reward system, specifically the mesolimbic dopamine pathway, which plays a major role in cravings and the cycle of addiction. Second, it impacts the brain's stress circuits, helping to calm the overactive responses that are often heightened in people struggling with substance use. And third, acupuncture supports the brain's ability to recover its cognitive functions, such as decision making, focus, and emotional regulation, which are often impaired during and after addiction. Beyond its physiological effects, acupuncture has emerged as a powerful tool for managing the emotional and psychological dimensions of addiction. Chronic substance use alters brain function, making individuals more vulnerable to anxiety, depression, and relapse triggers, even after detoxification. Acupuncture has been shown to calm overactive stress pathways, increase brain derived neurotrophic factor expression, and restore cognitive function, offering an integrative, non pharmacological approach to addiction recovery. This module will explore the clinical evidence supporting acupuncture's use in addiction medicine, the specific acupoints and techniques most effective for substance withdrawal, and the emerging role of auricular acupuncture and peripheral electrical stimulation in relapse prevention. A 2021 review by Lee et al., published in Neuroscience and Biobehavioral Reviews, explored the bidirectional role of acupuncture in treating drug addiction, meaning it can influence addiction in multiple ways. The study examined how acupuncture regulates the mesolimbic dopamine pathway, a key brain circuit involved in motivation, reward, and addiction, by affecting two major processes: incentive sensitization and opponent process mechanisms. Incentive sensitization refers to how repeated drug use makes the brain overly sensitive to drug related cues, leading to intense cravings, while the opponent process mechanism explains how the brain tries to maintain balance by producing opposing reactions, such as withdrawal symptoms when the drug is absent. The study highlighted acupuncture's ability to normalize both hyperactivity and hypoactivity of the dopamine system, helping to reduce both cravings and withdrawal symptoms by restoring chemical balance in the brain. Key findings indicated that acupuncture, particularly at heart 7, stomach 36, kidney 9, and liver 3, Acupoints, known for their effects on calming the mind and regulating the nervous system, suppresses drug-seeking behavior by influencing brain chemistry. Specifically, acupuncture helps regulate dopamine release, a neurotransmitter involved in pleasure and reward, enhances GABAergic inhibition, a process that slows down overactive brain signals, reducing stress and cravings, and stimulates endogenous opioid activation, the body's natural painkillers, such as endorphins, which help with withdrawal symptoms. Additionally, neuroimaging studies demonstrated that acupuncture reduces activity in craving related brain regions, including the medial prefrontal cortex, involved in decision making and impulse control. Nucleus accumbens, a key reward center that reinforces addictive behaviors, and amygdala, a region linked to emotional processing and stress responses. The study suggests that acupuncture could serve as an effective adjunct therapy for addiction by restoring neurochemical balance and reducing relapse risk. A 2015 study by Lee et al., published in the Journal of Acupuncture and Meridian Studies, investigated the effects of acupuncture on morphine craving using a progressive ratio schedule in animal models. The progressive ratio schedule is a method used in addiction research where animals must work progressively harder to receive a drug, helping to measure how strongly they seek it. In the study, rats were trained to self-administer morphine over 9 days. After this period, the rats were tested on the progressive ratio schedule to assess their level of drug-seeking behavior. In other words, how much effort they were willing to put in to obtain the drug. Acupuncture was applied at small intestine 5 immediately before the test session, while control groups received either no treatment or stimulation at a non-therapeutic site. Results showed that acupuncture at small intestine 5 significantly reduced morphine-seeking behavior, as indicated by a decreased breakpoint, the point at which the animal stops working for the drug. This suggests that acupuncture lowered the motivation to seek morphine. Furthermore, the effects of acupuncture were blocked when the rats were given 2 different drugs that influence GABA activity in the nervous system. Since GABA is the brain's main inhibitory neurotransmitter, these results indicate that the GABAergic system, which calms neural activity, plays a key role in acupuncture's ability to reduce cravings. Immunofluorescence analysis, a technique that highlights specific proteins in brain tissue, showed that acupuncture reduced C-FOS expression, which is a marker of brain cell activity, in 2 critical areas of the brain's reward pathway, the ventral tegmental area and the nucleus accumbens. These regions are deeply involved in addiction and motivation. The findings suggest that acupuncture may help reduce morphine cravings by regulating the GABA system and calming overactive dopamine activity in addiction-related brain circuits. A 1993 review by Brumbaugh, published in the Journal of Substance Abuse Treatment, explored the application of acupuncture in chemical dependency treatment with a focus on the development of auricular acupuncture protocols. The study traced the origins of auricular acupuncture for addiction treatment to Hong Kong in 1972, when Dr. H. L. Wen discovered that acupuncture alleviated heroin withdrawal symptoms. This method was refined at Lincoln Hospital in New York in the 1970s, leading to the establishment of the National Acupuncture Detoxification Association and its widely used 5-point auricular acupuncture protocol. The review highlighted clinical outcomes from various treatment centers, noting that implementing acupuncture increased program completion rates and improved abstinence outcomes among patients in detox programs. Despite these positive findings, the review noted institutional resistance to acupuncture's integration into mainstream addiction treatment with limited federal research funding. A 2008 review by Tsui et al., published in Neurochemical Research, examined acupuncture's role in addiction treatment, tracing its development from Dr. Wen's 1972 discovery to the establishment of the NADA protocol in 1985, and Dr. Jisheng Han's 2005 work refining electroacupuncture for addiction management. The review highlighted acupuncture's ability to regulate neurochemical systems, including the release of endogenous opioids such as enkephalins and dynorphins, which alleviate withdrawal symptoms and reduce cravings. Additionally, acupuncture was found to modulate dopamine activity in the ventral tegmental area and nucleus accumbens, helping to counteract drug-induced neuroplastic changes and suppress stress-related relapse by influencing the central amygdala. While acupuncture appears to be a valuable adjunct in addiction management, the authors emphasized the need for standardized treatment protocols and further large-scale clinical trials to confirm its efficacy. A 2023 study by Colzado et al., published in Addiction Biology, explored auricular transcutaneous vagus nerve stimulation, a technique known as VNS, as an additional treatment for opioid withdrawal. This non-invasive method involves stimulating the vagus nerve, which plays a crucial role in regulating the nervous system by applying electrical impulses to the ear. The study proposed that vagus nerve stimulation could serve as a complementary therapy by influencing the locus coeruleus noradrenaline system, a brain network involved in alertness, stress responses, and addiction-related withdrawal symptoms. Dysfunction in this system is linked to both opioid withdrawal symptoms, such as anxiety, agitation, and cravings, and cognitive impairment, including difficulty with focus and decision-making. The study concluded that vagus nerve stimulation holds promise as a safe, non-drug-based intervention to support recovery from opioid addiction, as it may help restore balance in brain chemistry and improve cognitive function. A 2005 study by Chen et al., published in Experimental Neurology, investigated the effects of low-frequency peripheral electrical stimulation on morphine-affected memory. Peripheral electrical stimulation involves applying small electrical currents to specific points on the body to influence the nervous system. The findings suggested that repeated treatments with peripheral electrical stimulation may help suppress drug-seeking behavior while also supporting cognitive function. This dual effect makes it a potential non-drug-based treatment for opioid addiction, offering an alternative approach to managing both cravings and cognitive decline associated with substance use. A 2000 randomized controlled trial by Avance et al., published in Archives of Internal Medicine, investigated the efficacy of auricular acupuncture in treating cocaine dependence among methadone-maintained patients. The study found that auricular acupuncture significantly increased the likelihood of providing cocaine-negative urine samples compared to control conditions. Acupuncture's role in addiction recovery extends far beyond its traditional use, with modern research highlighting its ability to rewire the brain's reward system and regulate key neurochemical pathways involved in substance dependence. As detailed in the 2023 review by Kitzman et al., acupuncture, particularly electroacupuncture, exerts frequency-dependent effects on opioid receptors, with low-frequency 2 Hz stimulation increasing enkephalin and endorphin release, and high-frequency 100 Hz stimulation enhancing dynorphin activity. This dual mechanism helps counteract withdrawal symptoms while reducing the reinforcing effects of drugs on the brain's reward circuits. Additionally, acupuncture modulates dopamine activity in the ventral tegmental area and nucleus accumbens. By normalizing dopamine fluctuations, acupuncture prevents the compulsive, drug-seeking behaviors that drive relapse. Functional MRI studies further support these findings, demonstrating that acupuncture reduces activation in craving-related brain regions, such as the prefrontal cortex, amygdala, and anterior cingulate cortex, effectively weakening the brain's conditioned response to drug cues. Beyond its effects on neurotransmitters, acupuncture offers a profound regulatory influence on stress and emotional states, two of the most powerful triggers for relapse. By inhibiting corticotropin releasing factor in the amygdala, acupuncture lowers stress-induced cravings and reduces the likelihood of relapse due to emotional dysregulation. Furthermore, research has shown that peripheral electrical stimulation enhances brain-derived neurotrophic factor expression, supporting neuronal recovery and cognitive function in opioid-addicted individuals. These neuroplastic effects not only aid in withdrawal management, but also help rebuild cognitive resilience, allowing individuals to break free from the cycle of addiction. While acupuncture should not be seen as a standalone cure, its ability to restore biochemical balance, dampen cravings, and enhance emotional stability makes it a powerful tool when integrated into comprehensive addiction recovery programs. The most commonly used acupuncture points in the clinical studies include auricular points from the NADA protocol, Shenmen, lung, sympathetic, kidney, and liver, selected for their role in autonomic nervous system regulation, stress response, and addiction cravings. Frequently used body acupuncture points include Heart 7 for its calming effects and modulation of stress-related neurotransmitters, Large Intestine 4 for systemic regulation and pain modulation, and Liver 2 and Liver 3 for their influence on emotional balance and detoxification. Additionally, Kidney 9 and Kidney 3 support neuroendocrine function, while Spleen 6 and Stomach 36 contribute to immune modulation and general well-being. Small intestine 5 is also notable for its role in stress regulation and addiction behavior. These points are chosen based on their demonstrated neurochemical effects, including modulation of dopamine, serotonin, and endogenous opioids, as well as their ability to regulate the hypothalamic pituitary adrenal axis and autonomic function. The selection reflects a strategy aimed at reducing cravings, alleviating withdrawal symptoms, and promoting emotional stability, making acupuncture a viable complementary approach in addiction treatment.